proposed some sweeping plans: free public college, free universal child care, eliminating most Americans' college debt. And you've said how you're going to pay for those plans, but you have not specified how you're going to pay for the most expensive plan, Medicare for All. Will you raise taxes on the middle class to pay for it, yes or no?
So I have made clear what my principles are here, and that is costs will go up for the wealthy and for big corporations, and for hardworking middle-class families, costs will go down. You know, the way I see this is I have been out all around this country. I've done 140 town halls now, been to 27 states and Puerto Rico. Should have done 70,000 selfies, which must be the new measure of democracy. And this gives people a chance to come up and talk to me directly. So I've talked with the family, the mom and dad whose daughter's been diagnosed with cancer. I have talked to the young woman whose mother has just been diagnosed with diabetes. I've talked to the young man who has MS. And here's the thing about all of them: they all had great health insurance right at the beginning. But then they found out when they really needed it, when the costs went up, that the insurance company pulled the rug out from underneath them, and they were left with nothing. Look, the way I see this, it is hard enough to get a diagnosis that your child has cancer, to think about the changes in your family if your mom's got diabetes, or what it means for your life going forward if you've been diagnosed with MS. But what you shouldn't have to worry about is how you're going to pay for your health care after that.
Senator Warren, to be clear, Senator Sanders acknowledges he's going to raise taxes on the middle class to pay for Medicare for All. You've endorsed his plan. Should you acknowledge it too?
So the way I see this, it is about what kinds of costs middle-class families are going to face. So let me be clear on this. Costs will go up for the wealthy, they will go up for big corporations, and for middle-class families, they will go down. I will not sign a bill into law that does not lower costs for middle-class families.
Mayor Buttigieg, you say Senator Warren has been, quote, evasive about how she's going to pay for Medicare for All. What's your response?
Well, we heard it tonight, a yes or no question that didn't get a yes or no answer. Look, this is why people here in the Midwest are so frustrated with Washington in general and Capitol Hill in particular. Your signature, Senator, is to have a plan for everything, except this. No plan has been laid out to explain how a multi-trillion-dollar hole in this Medicare for All plan that Senator Warren is putting forward is supposed to get filled in. And the thing is, we really can deliver health care for every American and move forward with the boldest, biggest transformation since the inception of Medicare itself. But the way to do it without a giant multi-trillion-dollar hole and without having to avoid a yes or no question is Medicare for all who want it. We take a version of Medicare, we let you access it if you want to, and if you prefer to stay on your private plan, you can do that too. That is what most Americans want. Medicare for all who want it, trusting you to make the right decision for your health care and for your family, and it can be delivered without an increase
Senator,
on
your
middle class
response?
taxes.
So let's be clear. Whenever someone hears the term Medicare for all who want it, understand what that really means. It's Medicare for all who can afford it. And that's the problem we've got. Medicare for all is the gold standard. It is the way we get health care coverage for every single American, including the family whose child's been diagnosed with cancer, including the person who's just gotten an MS diagnosis. That's how we make sure that everyone gets health care. We can pay for this. I've laid out the basic principles. Costs are going to go up for the wealthy. They're going to go up for big corporations. They will not go up for middle-class families, and I will not sign a bill into law that raises their costs, because costs are what people care about. I've been studying this, you know, for the biggest part of my life.
Thank you, Senator.
Why people go
can the
bankrupt.
mayor respond? Sure.
I don't think the American people are wrong when they say that what they want is a choice. And the choice of Medicare for all who want it, which is affordable for everyone because we make sure that the subsidies are in place, allows you to get that health care. It's just better than Medicare for all whether you want it or not. And I don't understand why you believe the only way to deliver affordable coverage to everybody is to obliterate private plans, kicking 150 million Americans off of their insurance in 4 short years when we could achieve that same big, bold goal. And once again, we gotta be president we're competing to be president for the day after Trump. Our country will be horrifyingly polarized, even more than now. After everything we've been through, after everything we are about to go through, this country will be even more divided. Why unnecessarily divide this country over healthcare when there's a better way to deliver coverage for all?
Senator Sanders.
Well, as somebody who wrote the damn bill, as I said, let's be clear. Under the Medicare for All bill that I wrote, premiums are gone. Co-payments are gone. Deductibles are gone. All out-of-pocket expenses are gone. We're going to do better than the Canadians do, and that is what they have managed to do. At the end of the day, the overwhelming majority of people will save money on their health care bills. But I do think it is appropriate to acknowledge that taxes will go up. They're going to go up significantly for the wealthy. And for virtually everybody, the tax increase they pay will be substantially less than what they were paying for premiums and out-of-pocket expenses.
Well,
Senator Warren, will you acknowledge what the senator just said about taxes going up?
So my view on this and what I have committed to is costs will go down for hardworking middle-class families. I will not embrace a plan like Medicare for All who can afford it. That will leave behind millions of people who cannot. And I will not embrace a plan that says people have great insurance right up until you get the diagnosis and the insurance company says, sorry, we're not covering your expensive cancer treatments. We're not covering your expensive treatments for MS.
Senator
We're not covering
Klobuchar.
what you need.
At least Bernie's being honest here and saying how he's going to pay for this and that taxes are going to go up. And I'm sorry, Elizabeth, but you have not said that. And I think we owe it to the American people to tell them where we're going to send the invoice. I believe the best and boldest idea here is to not trash Obamacare, but to do exactly what Barack Obama wanted to do from the beginning, and that's have a public option that would bring down the cost of the premium and expand the number of people covered and take on the pharmaceutical companies. That is what we should be doing instead of kicking 149 million people off their insurance in 4 years. And I'm tired of hearing, whenever I say these things, oh, it's Republican talking points. You are making Republican talking points right now in this room by coming out for a plan that's going to do that. I think there is a better way that is bold, that will cover more people, and it's the one we should get behind.
Senator Warren.
You know, I didn't spend most of my time in Washington. I spent most of my time studying one basic question, and that is why hardworking people go broke. And one of the principal reasons for that is the cost of health care. And back when I was studying it, 2 out of every 3 families that ended up in bankruptcy after a serious medical problem had health insurance. The problem we've got right now is the overall cost of health care. And look, you can try to spin this any way you want. I've spent my entire life on working on how America's middle class has been hollowed out and how we fight back. I put out nearly 50 plans on how we can fight back and how we can rebuild an America that works. And a part of that is we've got to stop Americans from going bankrupt over health care.
Senator Klobuchar, do you want to respond?
Yes, I do. And I appreciate Elizabeth's work. But again, the difference between a plan and a pipe dream is something that you can actually get done. And we can get this public option done, and we can take on the pharmaceutical companies and bring down the prices. But what really bothers me about this discussion, which we've had so many times, is that we don't talk about the things that I'm hearing about from regular Americans. That is long-term care. We are seeing, I once called it a silver tsunami, the aging, and then someone told me that was too negative, so I call it the silver surge. The aging of the population. We need to make it easier to get long-term care insurance and strengthen Medicaid. In this state, the state of Ohio, that has been hit by the opioid epidemic, we need to take on those pharma companies and make them pay for the addictions that they have caused and the people that they have killed.
Thank you, Senator.
Those are the issues that I hear about when I'm in
Vice President Biden.
I'd like to be here.
Let me bring you in here, Vice President, for your response. Are Senators Warren and Sanders being realistic about the difficulty of enacting their plans?
Well, first of all, the plan we're hearing discussed is the Biden plan, the one I put forward. Build on Obamacare, add a public option. We can go into that. I can talk about that if you like. But here's the deal. On the single most important thing facing the American public, I think it's awfully important to be straightforward with them. The plan is going to cost at least $30 trillion over 10 years. That is more on a yearly basis than the entire federal budget. And we talk about how we're going to pay for it. The study recently came out showing that, in fact, it will reduce cost. But for people making between $50,000 and $75,000 a year, their taxes are going to go up about $5,000. Because the fact is, they'll pay more in new taxes, 7.4%. Plus or 5% plus a 4% income tax. If a fireman and a school teacher are making $100,000 a year, their taxes are going to go up about 10 grand. That is more than they will possibly save on this health care plan. We have a plan put forward that will work.
Senator Sanders, do you want to respond?
I get a little bit tired, I must say, of people defending a system which is dysfunctional, which is cruel. 87 million uninsured, 30,000 people dying every single year, 500,000 people going bankrupt. For what reason? They came down with cancer. I will tell you what the issue is here. The issue is whether the Democratic Party has the guts to stand up to the healthcare industry, which made $100 billion in profit, whether we have the guts to stand up to the corrupt, price-fixing pharmaceutical industry, which is charging us the highest prices in the world for prescription drugs. And if we don't have the guts to do that, if all we can do is take their money, we should be ashamed about something.
Thank you, Senator. Senator Harris, your response?
This is the 6th debate we have had in this presidential cycle, and not nearly one word with all of these discussions about health care on women's access to reproductive health care, which is under full-on attack in America today. And it's outrageous. There are states that have passed laws that will virtually prevent women from having access to reproductive health care. And it is not an exaggeration to say women will die. Poor women, women of color will die because these Republican legislatures in these various states who are out of touch with America are telling women what to do with our bodies. Women are the majority of the population in this country. People need to keep their hands off of women's bodies and let women make the decisions about their own lives.
Thank you, Senator.
And let's talk about
Senator.
that. That is a significant health care issue in America today.
I want
Thank
to
you,
turn now to jobs. According to a recent study, about a quarter of American jobs could be lost to automation in just the next